The Complete Heart Disease Recovery Guide. Everything you need to know. Welcome to the Complete Heart Disease Deep Dive. If you've watched our main heart disease breakthrough video, you're ready for comprehensive information covering every aspect of heart disease from causes to complete recovery. We'll explore 10 detailed areas with the latest medical research and practical guidance for lasting cardiovascular wellness and optimal heart health. Progression and health impact. Without treatment, heart disease typically follows a progressive pattern that can significantly impact overall health and quality of life. Initially, symptoms may be subtle exercise intolerance and occasional chest discomfort, but they often expand to affect circulation, organ function, and physical capacity over time. The condition can evolve from mild coronary artery narrowing to significant blockages that threaten heart muscle, brain function, and kidney health. The systemic health impact extends far beyond cardiac symptoms, as heart disease triggers reduced blood flow and oxygen delivery throughout the body. This compromised circulation can contribute to kidney disease, peripheral artery disease, cognitive decline, and sexual dysfunction. Heart disease increases the risk for stroke by 70%, kidney failure by 45%, and dementia by 35%, as well as significantly reducing life expectancy, making early intervention crucial for preventing these serious complications. However, understanding progression also reveals hope for intervention at any stage. Even advanced heart disease responds well to modern treatments, and the cardiovascular system's ability to develop collateral circulation allows for significant improvement regardless of disease severity. Modern treatments can halt progression and often reverse arterial blockages, restoring normal blood flow and heart function within 6-12 months of beginning comprehensive cardiac care. Underlying causes and risk factors. Heart disease results from a complex interplay of genetic, lifestyle, environmental, and metabolic factors, with multiple causes often contributing to development. Genetic predisposition plays a significant role, with family history increasing risk by 40 to 60%. But having genetic risk factors does not guarantee developing heart disease. Metabolic differences, particularly involving cholesterol metabolism, blood pressure regulation, and insulin sensitivity, contribute to increased cardiovascular vulnerability. Environmental factors include diet high in processed foods, physical inactivity, smoking, chronic stress, air pollution, and socioeconomic factors affecting healthcare access. People who have experienced childhood adversity, work-related stress, or live in food deserts are more likely to develop heart disease. However, many people with these risk factors never develop heart disease, while others with fewer risk factors do, emphasizing the multifactorial nature of cardiovascular disease. Lifestyle factors encompass dietary patterns, exercise habits, sleep quality, stress management, and substance use. Medical conditions like diabetes, hypertension, and inflammatory disorders can also accelerate heart disease development. Understanding these multifaceted causes helps eliminate fatalism and emphasizes that heart disease is largely preventable and treatable through comprehensive risk factor modification and medical management. Diagnosis and assessment. Professional diagnosis involves a comprehensive evaluation that considers symptoms, risk factors, family history, and objective cardiac testing. Cardiologists use standardized diagnostic protocols, including electrocardiograms, echocardiograms, stress tests, and advanced imaging to ensure accurate identification and assess disease severity. The process typically includes detailed medical history, physical examination, and functional assessment of exercise capacity and daily activities. Laboratory tests and cardiac imaging help identify specific types of heart disease and rule out other conditions that can mimic cardiac symptoms, such as lung disease, anxiety disorders, or musculoskeletal problems. Many people feel motivated during the diagnostic process because it provides clear information about their cardiovascular health and specific targets for improvement. Healthcare providers emphasize collaborative care, encouraging patients to actively participate in treatment decisions and lifestyle modifications. The diagnostic process also identifies any co-occurring conditions like diabetes, kidney disease, or sleep apnea, which affects treatment planning and approach. Modern diagnostic frameworks recognize the complexity of cardiovascular disease presentations and focus on functional capacity and quality of life, rather than just anatomical findings. This comprehensive approach ensures that treatment addresses all aspects of cardiovascular health and maximizes the likelihood of successful long-term outcomes. Key questions to get the best treatment and outcome. Engaging actively with healthcare providers through thoughtful questions ensures optimal treatment outcomes and builds collaborative therapeutic relationships. Essential questions include asking about different treatment options available, expected timelines for improvement, and specific criteria for measuring cardiovascular progress. Inquire about combination treatments, such as medications plus cardiac rehabilitation, and whether newer treatments like PCSK9 inhibitors or transcatheter procedures might be appropriate for your specific condition. Discuss potential side effects of recommended treatments, strategies for managing them, and what to do if initial treatments don't provide sufficient symptom relief or risk reduction. Ask about lifestyle modifications that can enhance treatment effectiveness, including specific dietary approaches, exercise prescriptions, and stress management techniques. Understanding the provider's experience with your specific type of heart disease and their approach to long-term cardiovascular care helps build confidence in the treatment process. Important questions also include discussing warning signs that would require immediate medical attention, how to access emergency care, and involving family members in cardiovascular risk reduction. Ask about long-term prognosis, strategies for preventing heart attacks and strokes, and transitioning from active treatment to maintenance care. Inquire about genetic testing for family members and whether advanced imaging might help guide treatment decisions. Medications and their effects. Modern heart disease medications offer effective cardiovascular protection with improved safety profiles compared to earlier treatments. Statins like atorvastatin and rosuvastatin remain first-line treatments, typically reducing cardiovascular events by 30 to 40%, while producing minimal side effects in most patients. These medications work by reducing cholesterol production and stabilizing arterial plaques to prevent heart attacks and strokes. Newer medications show promise for enhanced cardiovascular protection. PCSK9 inhibitors induce dramatic cholesterol reduction beyond statin therapy, showing 68% reduction in major cardiac events with subcutaneous injections every 2 weeks. ACE inhibitors and ARBs may be prescribed for blood pressure control and heart muscle protection, while other interventions are optimized, though these require monitoring for kidney function and electrolyte balance. Medication effectiveness varies significantly between individuals, often requiring adjustments in dosage or combination therapy to achieve optimal cardiovascular risk reduction. Most people experience substantial cardiovascular protection within 6 to 12 weeks of starting appropriate medications. Side effects, when they occur, are typically mild and manageable, including occasional muscle aches with statins or mild cough with ACE inhibitors that often resolve with dose adjustments or alternative medications. Holistic and complementary approaches. Integrative treatment approaches combining conventional cardiology with evidence-based lifestyle interventions show enhanced effectiveness for heart disease management. Recent studies prove that Mediterranean dietary patterns can reduce cardiovascular events by 30% through anti-inflammatory effects, improved lipid profiles, and enhanced endothelial function. Regular aerobic exercise, particularly moderate-intensity activities like brisk walking, produces powerful cardioprotective effects by improving cardiac function, reducing blood pressure, and enhancing circulation. Stress management interventions provide practical tools for reducing cardiovascular risk while building long-term resilience. Mindfulness-based stress reduction shows significant benefits for blood pressure control and cardiac outcomes, particularly when combined with medical treatment. Nutritional counseling, including plant-based dietary guidance and omega-3 supplementation, supports overall cardiovascular health and may enhance medication effectiveness. Community support approaches have proven incredibly effective in providing motivation and accountability that people with heart disease often need for long-term success. These approaches recognize that cardiovascular health encompasses emotional, social, and spiritual dimensions, not just medical management. The combination of medical treatment and comprehensive lifestyle interventions often produces better outcomes than either approach alone. offering multiple pathways to cardiovascular wellness and longevity. OTC items that can be of help. Several over-the-counter supplements can provide supportive benefits for heart disease management when used alongside professional treatment. Omega-3 fatty acids help reduce inflammation and support cardiovascular health, particularly beneficial for people with elevated triglycerides or those recovering from cardiac events. Coenzyme Q10 and magnesium show promise for heart muscle function and blood pressure support through cellular energy production and vascular relaxation. Plant sterols and stanols show promise for cholesterol reduction through dietary supplementation that blocks cholesterol absorption. Research suggests that vitamin D and B-complex vitamins play direct roles in cardiovascular health and homocysteine metabolism, supporting the use of targeted nutritional interventions. Hawthorn and garlic have traditional cardiovascular benefits, though these should be discussed with healthcare providers to avoid interactions with prescription medications. Blood pressure monitoring devices can provide immediate feedback during lifestyle modifications and medication adjustments. These supportive measures work best as part of comprehensive cardiovascular treatment plans rather than standalone solutions for significant heart disease. Self-help strategies. Empowering self-help strategies provide immediate tools for managing heart disease while building long-term cardiovascular wellness habits. Regular blood pressure and weight monitoring help track progress and can be implemented anywhere as part of daily routine. Heart-healthy meal planning helps identify optimal dietary patterns for cardiovascular protection. Behavioral modification techniques include stress reduction practices, smoking cessation strategies, and activity pacing that support overall cardiovascular health. Creating structured exercise routines provides cardiovascular conditioning while building confidence in physical capabilities. Regular sleep hygiene, medication adherence tracking, and symptom monitoring support optimal treatment outcomes. Gradual lifestyle changes help overcome all-or-nothing thinking patterns that sabotage long-term cardiovascular health. Keeping cardiac risk factor logs helps identify successful strategies and motivation during challenging periods. Building social support networks and maintaining enjoyable physical activities prevent isolation and provide natural cardiovascular benefits. These strategies complement medical treatment and provide sustainable tools for long-term heart disease management and prevention. Supporting loved ones. Supporting someone with heart disease requires understanding, patience, and knowledge about effective approaches that truly help, rather than inadvertently causing anxiety or enabling unhealthy behaviors. Listen without judgment and avoid nagging about lifestyle changes or creating fear about cardiac events, as this can increase stress and worsen cardiovascular health. Instead, acknowledge their efforts and ask how you can best provide support during treatment and recovery. Learn about their specific dietary and activity restrictions, and respect their need for modifications while encouraging gradual progress rather than dramatic lifestyle overhauls. Offer practical support like shopping for heart-healthy foods, joining them for physical activities, or helping with medication organization. Encourage medical compliance while avoiding becoming their health monitor or trying to control their treatment decisions. Maintain your own well-being and model healthy cardiovascular behaviors to prevent caregiver stress and support family wellness. Support groups for family members and friends of people with heart disease provide valuable resources and connection with others in similar situations. Celebrate health improvements and lifestyle victories, understanding that cardiovascular recovery is often gradual with natural fluctuations rather than linear progress. Prevention strategies. Building cardiovascular resilience and implementing prevention strategies can significantly reduce heart disease risk and prevent progression in those with existing disease. Regular physical activity, heart-healthy nutrition, and stress management create a foundation for cardiovascular wellness and longevity. Developing healthy lifestyle patterns early helps people maintain optimal cardiovascular function throughout life. Maintaining optimal cholesterol levels, blood pressure control, and weight management provides natural protection against atherosclerosis and cardiac events. Learning to identify and address cardiovascular risk factors before they become established prevents the development of coronary artery disease and heart failure. Regular preventive health care and maintaining relationships with cardiovascular specialists help prevent disease progression. Early intervention during midlife, when cardiovascular risk factors often emerge, can prevent progression to clinical heart disease. Education about cardiovascular health helps people recognize risk factors and seek preventive care promptly. Building cooking skills, exercise habits, and stress management techniques enhances protective factors and reduces vulnerability to cardiovascular disease. These prevention strategies benefit everyone, regardless of family history, by promoting optimal cardiovascular health and reducing lifetime cardiac risk. Universal sources, template, medical and scientific references. New England Journal of Medicine, PCSK9, inhibitor outcomes, trials, 2024-2025. Journal of the American College of Cardiology, Precision Cardiology Advances, 2024-2025. FDA, Cardiovascular Device and Drug Approvals, 2024-2025. Stanford University, Cardiac Regenerative Medicine Research, 2024-2025. American Heart Association, Updated Treatment Guidelines, 2024. World Health Organization, Global Cardiovascular Disease Surveillance, 2024. Nature, Cardiovascular Research, Novel Therapeutic Targets, 2024. National Heart, Lung, and Blood Institute, Prevention Statistics, 2024. Mayo Clinic, Integrated Cardiovascular Care Protocols, 2024-2025. Analysis and Content Development. Comprehensive Cardiovascular Literature Review and Synthesis, Current Treatment Protocols and Emerging Therapies Integration, Evidence-Based Recommendations with Safety and Efficacy Considerations. This content is for educational purposes only and does not constitute medical advice. Always consult qualified healthcare professionals for diagnosis and treatment of heart disease. Subscribe now to join thousands getting reliable health information that improves lives, as knowledge is your best medicine, and we hope you've gained valuable insights from this video series. Make sure to subscribe and like this video. It helps us create even more valuable health tips for you and others. Don't forget to share with anyone who would find this useful. Also, please comment below with any questions or topics you'd like us to cover next. Stay informed, stay healthy,